Hello, I'm Jane from the National Autistic Society, and as this week is Mental Health Awareness Week, we thought it would be a good time to update everybody about what's happening with the Mental Health Act and what that means for autistic people. So first of all, what is the Mental Health Act? Well, it's a set of rules that says when somebody can have their liberty taken away and when somebody can be forced to have treatment for what's called a mental disorder. Now, slightly oddly, the Mental Health Act defines mental disorder to include autism, even though, as most of us know, autism is not a mental health condition. So that means that, in effect, lots of autistic people can end up having their liberty taken away and being forced to live in a hospital and have treatment even if they don't have a mental health problem, purely because they're autistic. That's not a great situation for anybody. Just imagine having your liberty taken away, being forced to live in a hospital that really actually isn't even helping you, where even treatment can be almost detrimental because the environment just isn't autism friendly, and that hospital could also be hundreds of miles away from your friends and family. So that's a situation that we really want to change at the National Autistic Society, and we think one of the ways that we can do that is to try and change the Mental Health Act. So what are we doing now? Well, the first thing we're doing is we're trying to, through our social care services, support as many people as possible who are in that situation to leave hospital and come out to a life in the community, a life that anybody else would want. We know we can't do that for everybody because that will depend on local commissioners giving us funding to do that, and it will depend on professionals in hospitals planning ahead through what's called a care and treatment review to allow somebody to leave hospital and to try out some other kinds of support. So that's the first thing. The second thing we're trying to do is make sure that many more families in that situation get the information that they need. Too many families don't know how to challenge the process, don't know how to support their loved one through a care and treatment review kind of process. And we want to try and use our networks and use our resources to help families to connect to each other, to share that kind of information, to share what has worked for them. And we're thinking about how we can do that better. But the third thing is trying to campaign to make sure that the Mental Health Act is really fit for purpose. And what's great news is that the interim report that's come out from the Mental Health Act review team has recognised that things are not working for autistic people. So there's 4 things that they've said. I'm just going to get them up. Autism. Firstly, it said that autistic people can end up being sectioned and being treated under the Mental Health Act purely because there aren't enough community services. Not because they need that treatment, and not because they need to be in hospital, but just because there aren't the right services in the community. Secondly, it says that understanding of autism isn't good enough among mental health professionals. We absolutely agree with that. That's sometimes why it's really difficult for people to end up in hospital, because the professionals who are meant to be supporting people just don't understand autism. Thirdly, it says that autistic people can end up spending years and years in hospital. That is sadly really true. We have met many families who talk about their loved ones spending a year or 2 or even longer in a hospital. And fourthly, it said that autistic people are often in hospital miles and miles away from their loved ones, which obviously makes the experience much worse for absolutely everybody. So it's really great that this review has realised that those 4 things are true. Let's be honest, that won't change anybody's experience tomorrow. There are still hundreds of autistic people who are in hospital who don't need to be, and it's still a massive struggle for them and their families to get them the right support. But given this review could have looked at all kinds of issues, not just about autistic people, but about all kinds of issues, it's very good news that it has recognised that what is going wrong for autistic people and their families. It's a first step to changing that. We are going to keep pushing to make sure that the next stage of the review puts in place concrete action so that autistic people don't end up in hospital who do not need to. None of us enjoy being in hospital, but imagine being in hospital if actually being there was making your condition worse, was making your life and your health worse, not better. It's an unbearable situation for many autistic people and their family members. I also just want to say thank you to everybody who's been in that situation, who has shared their experience with the review. A lot of the time, people are sharing very traumatic experiences, and it's sometimes very hard to do that. And I think we need to applaud everybody's bravery and courage in doing so. So we will continue to push for changes to make sure there is concrete action to change this situation for people. If you want to keep up to date with what we're doing in this area, please sign up for our email updates, which you can do at autism.theyve.org. and we will also continue this Mental Health Awareness Week to share other people's experiences of mental health problems and being autistic, and just what it's like to try and get treatment if you do have a mental health problem, but also what it's like if you end up sectioned under the Mental Health Act when you actually don't have a mental health problem, you're just autistic.